here with Zia. I'm hoping I'm pronouncing that correctly.
You are.
And Zia, you identify yourself as a transsexual, and I saw your blog site, which is called The Lonely Transsexual. So tell me a little bit about why you use the term transsexual when transgender is sort of all the rage right now.
I think to me, transsexual is my diagnosis, not my identity. I don't believe that any diagnosis causes somebody to change a biological sex. Um, I absolutely believe that my sex will remain biologically male all throughout my life, no matter what sort of surgeries or hormones or whatever I do. And I see myself, I am a male person with transsexualism. It's not central to who I am. I don't build an identity around it. I'm just a man who is transsexual. And I don't see any need to be anything else other than that.
And so I've talked to Jen Smith, who is also transsexual. And Jen Smith has not gone through any surgeries or had hormones. He really is just, and yet I think he calls, I'm not sure if he identifies as transgender or transsexual or just as a cross-dresser. I'm not sure. Sometimes those are kind of hard gradations to sort of figure out. But my understanding is you went through surgery.
Yes, I'm post-op. I think I was asked something very, very interesting by a psychologist quite a while ago now. And she said there's a difference between the people who want to have a vagina or don't want to have a penis. And for me, it wasn't that I wanted to acquire something. It was that I felt I needed rid of something. And to me, it was almost a body dysmorphia because my male anatomy was a sort of reminder of who I was, and I felt it was stopping me from really living my best life. And it came down to the enforcement of gender stereotypes when I was a child. And to me, this anatomy was what stopped me from being me.
Wow.
And having the surgery, I just felt kind of give me permission to be myself, if that makes any sense whatsoever.
And so did you, you had, I'm not sure what the word is. Did you have vaginoplasty or did you just have your penis and testicles removed?
I had another option, which is a vulvoplasty. So I had my penis removed, the testicles removed. It was externally made into the form of female genitalia. There was a clitoris created, but there is no vaginal opening. It was just something I just not interested in sex. I just didn't see any benefit in doing that. I wasn't trying to acquire something. I just wanted rid of something.
And I've heard that before with my friend Billy. He had his penis removed, and it was because he had such a dislike for his penis, not so much because he wanted a vagina.
Yeah.
And so that's a really different kind of, and one of the things that I kind of wanted to talk to you about, and I know originally you reached out to me because I asked for someone who could talk about the cost of surgery. So if I'm ever like broaching topics that you're uncomfortable with, just let me know. But there's this sort of, I think that people believe that there's this thing called transgender, and it's this huge umbrella, and they don't realize that there are all these nuances to it. So they don't understand that there are, there's, autogynephilics, which clearly that's not what you are. There are people like, and you sound very similar to me, the kind of gender dysphoria I had as a kid, just this intense hatred towards my female parts. And I would have gotten rid of them if I could have, if there was a way to, make that part go away. And that sounds very similar to what you're talking about. And then there's the rapid onset gender dysphoria. And so there's all these nuances to it. And I was wondering if you could just talk about that a little bit, because you said that you're not the typical transgender activist.
I'm the complete opposite of a transgender activist. I have a big, big issue with this whole umbrella. People talk about trans rights. We have got a huge fundamental problem with any form of trans rights, because there's just so many disparate parts within the umbrella that trying to find something that fits all just isn't going to work. And you've got, whether they want to be or not, you've got people who are intersex or under the transgender umbrella, people who are fetishistic about cross-dressing or autogynephilia are transgender, people who have severe dysphoria and dysmorphia over their body are transgender. People who simply just say they're transgender are transgender. It's just too
Well,
broad a
and at
group.
this point, any child who doesn't adhere to rigid gender stereotypes, they're suggesting could be transgender.
That, to me, is probably the biggest issue. I would say probably 99% of what is being labeled as transgender is simply gender nonconformity. I'm very much a supporter of gender critical ideology. The idea that rejecting a societal construct of gender would cause you to change your biological sex, to me, I just can't get my head around. If I said, if I reject the gender stereotype, I'll grow 3 foot taller and my eyes will change colour, people would laugh at me. Yet we can say, well, if I reject a stereotype, suddenly I'll change biological sex. I just cannot get my head around that.
And so you mentioned that you're not supportive of biological males competing in female sports, or even biological males self-IDing as females. So how do you kind of categorize yourself?
I think for me, I wish I was born female. That's an absolute given, and I still, to this day. And I could try and convince myself and come up with some sort of line and kid myself, yeah, but really you are female, I've had the surgery. It doesn't make it true, and it's not psychologically healthy to try and convince myself I'm something that I'm not. And I think it's confused people because they turn around and say, well, because you say you're a man, you're not trans. That's quite a new phenomenon. In fact, the phrase trans woman didn't actually appear at all until 1996.
Wow.
The word transsexual has been used for decades before that, but the actual term trans woman is only the last 20 years. If you look at the historically, people were having reassignment surgery, you used to have to sign the paperwork to say, I understand this means I'm not changing biological sex. And we have just completely shifted from that. This, for me, is about relieving the side effect or the symptoms of a psychological disorder. It's not part of deluding myself to believe that I'm actually female. It's not part of a fantasy or role play. It is me wanting to live my best life free from some quite damaging psychological effects caused by gender ideology and enforced gender roles when I was younger. And I do resent the fact that gender roles took me to some quite dark places. I've had 3 mental breakdowns. I've been hospitalized, and I have been driven to the point of suicide. And when I have people coming along and saying, oh, I like dressing up my wife's pants on a Friday night, I'm just like you. No, actually, you're not. And that is so disrespectful and offensive to me. And you know what? If you choose to do that with your wife and everybody's happy about it, don't let me stop you. But don't tell me because you enjoy a certain activity that you can suddenly put yourself under the same umbrella as me and think that somehow compares, because it doesn't.
Well, and I think one of the things that you're talking about that is really important to define is the fact that you've had these feelings from the time you were really, really little. These are not feelings that you sort of decided upon after viewing social media about the trans phenomenon. This is something that has been of distress for you, I'm guessing, for as long as you can remember.
I'm probably quite unique to a lot of trans people in that I didn't want to transition. And I still wish I hadn't transitioned. It doesn't mean I didn't need to transition, but I didn't want to transition. The most important thing in my life, what is central to who I am, is my Christian faith. It always has been. And I grew up in a very, very strictly religious environment. And to me, that was a big, big problem. Now, I'm not anti-religion, and my faith is still very important to me. But in that environment, men had to be a certain way, women had to be a certain way, and it was very, very rigidly enforced. And I grew up feeling that if I deviated in any way from what my church was telling me men were meant to be, I was condemning myself to hell. So I made myself miserable because I thought it made God happy. And that went on for a long, long, long time. And my situation got worse. I ended up with agoraphobia. I was completely housebound. I couldn't leave the house. And I knew it was because I was playing a part. I was trying to pretend to be something that I wasn't. But I thought, well, God's happy. That's all that matters. And then I reached the point where I got sort of desperate. And I kind of asked the question, well, look, what kind of God would have me be this miserable and live my life the way I'm living? Because I had no quality of life. And I did 2 years of Bible college. And that was really what changed it to me. And it kind of said, well, you know what? I can actually transition, or I can do something about it. I can reject those gender roles. And I don't actually believe the Bible does condemn it. And that gave me the permission to do that. But the feelings that I had were there, even from nursery school, in the way that I wasn't playing properly, because boys don't play like that. Boys don't choose those toys. This isn't what boys are supposed to do. And that goes right back to my earliest memories.
So do you feel like if you had grown up in an environment where it was okay for you to be gender nonconforming, that you wouldn't have had so much distress?
That's a question I've asked myself so many times. I think probably every transsexual asks that. I think anybody that's struggled with gender dysphoria asks that. I'm sure you've probably asked that question. I think ultimately, yes. Had I been allowed to be gender non-conforming, I wouldn't have had the issues. And I think, common sense, if we look at the definition of transgender, where it is that mismatch between your biological sex and your gender identity. If you did not have a gender identity imposed upon you and there were no rules attached to gender, you can't have that mismatch. So in a gender critical / gender non-conforming environment, I don't see how you can be trans.
Although I suspect in my case, because I had so much hatred for my genitalia and my female physical body, I think I probably still would have had dysmorphia, even if I didn't have gender dysphoria.
It's very, very interesting because one of the things that transgenderism seems to have dropped, but is very much a part of transsexualism, is dysmorphia. Dysmorphia and dysphoria, as you know, are very, very different things. Dysphoria is directed discomfort towards your gender roles and your gender stereotypes, whereas dysmorphia is directed at your body. Now, I do not believe it is appropriate for people to be looking to making changes to their physical form solely because of dysphoria. I think in cases of dysmorphia, that's a much more complex clinical picture and does need a lot more input. But we've got people choosing to change their body solely because of discomfort over a gender identity that in fact are perfectly happy with their body. And ultimately, I think that is why we're seeing so much regret from people that we never saw before over surgery. Because they're being led to believe, well, you're unhappy with your gender identity. Snip, snip, you can actually change biological sex. It's just as good as the real thing. Look, you're now a woman. And that's not actually the reality. Surgical satisfaction for me was 100% guaranteed because the end result I was looking for was not to have a penis. And how could I ever not be satisfied with that result?
And
If my goal
so
from surgery,
you're feeling very satisfied with your surgery.
absolutely. But
And
if my goal in
how
surgery
long
was
ago
that
was it?
it was 25th of October last year.
Okay.
It was quite recent. But if my goal from that surgery had been, I really like my penis, but actually, I think I prefer a vagina, and I'm expecting to have a fully functional, anatomically comparative vagina, that was never going to happen. And I would have been very disappointed. But my surgical goal was met, and I was very, very happy from the minute I came around from the anaesthetic. It didn't matter what it looked like, because it was what wasn't there, and that was my goal.
So, how do you feel about children who might have dysmorphia pursuing medical treatments?
Um, I think very, very, very few children actually have dysmorphia.
And that's one of the things that I think is important. If you look at the rates of trans identity, transsexualism, whatever you want to call it, from 20 years ago versus now, the rates are just incredibly exploding. I mean, it's an epidemic now, and I think it's because dysphoria is now under that umbrella of transsexual transgenderism, whereas a lot, like you mentioned, a lot of these, they don't have the dysphoria or the dysmorphia, or if they do, it's almost because of the dysphoria. It's almost like they've decided to have the dysmorphia, if that makes sense.
I have never met a woman yet, certainly not a sort of younger teenager, that didn't have some element of dysmorphia, that didn't have that thought, you know what, life would be so much better if I was male.
Well, and they used to call it penis envy when I was a kid.
I think that is absolutely natural because of the nature of the society that we live in. It is very much oriented towards a male environment. And we do have a lot of girls now thinking that, and it's very sad, that to succeed in life and to be somebody in life, I have to be a man. That's very, very sad. But that is the reality of the situation. The fact that we have such an explosion of girls wanting to transition from what we used to have is quite shocking. And I believe in the UK that's actually exceeded the number of young men that are looking to transition. And I think it comes down to the way society is, and I think society has gone backwards in many ways. We went through a phase where we were breaking down the barriers of sort of gender norms. And we've just swung completely the opposite way now. And we're now back to reinforcing gender roles and gender stereotypes in a way that takes us back to the 1950s. That's very, very sad. So, yeah, we're going completely opposite direction.
Yeah, and that's where when you see sort of I don't know if you've seen this gender spectrum where they have like a G.I. Joe army guy on one side and a Barbie on the other, and they ask kids to decide where they are on that spectrum. To me, that's just incredibly offensive and so regressive.
They talk about, there's 365 genders now. People say, there should only be 2. I can go the other way. I say there's 7 billion genders, which is the population of the planet. Everybody is unique. Nobody conforms to gender roles and stereotypes in exactly the same way. And you can't put people's genders in boxes. So I'm one of 7 billion genders. My gender is called me. It's not whatever gender. I saw one the other day, it was Tetris gender. Name of one of the genders. It doesn't seem to fit neatly in any way. Yeah, Tetris gender is one of the new brand of genders.
Wouldn't most of us be that? I mean, I would think, I know very few people who fit into these very rigid gender stereotypes.
I asked that question on Twitter, and it didn't go down terribly well. Why, when probably very, very few people neatly fit into these sort of gender boxes and these roles and stereotypes, what makes somebody identify themselves as trans when most other people don't? And I'm not sure I've got an answer for that. Yeah, some people go enough that they're trans, but so many people just they throw out the gender roles, they throw out the gender stereotypes, they just be themselves. And, they don't choose an identity behind it.
Well, I really feel like a lot of it these days is that kids are being taught that they're the oppressors. And the only way to sort of overcome being that oppressor in our society is to have one of these marginalized roles. And really, transgender is one of the few roles that you can adopt rather than what you're born with. And so to me, I really see it in a lot of ways as a coping mechanism against a society that's saying that unless you're one of these oppressed identities, you're part of the problem and you're part of the oppressive group.
When I was younger, you're either gay or straight, and it was fairly sort of black and white.
Yeah.
Now I believe it's LGBTQIAA 2P plus, I think it is now.
Maybe even a couple pluses.
I think there's probably a couple more things that I've actually forgotten about.
Yeah.
And some of the things that are getting included within that umbrella, I'm not so sure there's probably not less people outside of the umbrella there is inside it. It's very, very interesting. Even when you look at the flags, and if you are not within that LGBT community, your flag is grey. It's boring. It's not interesting. But if you identify within, look at these wonderful, colourful flags you get, wonderful banners you get, but otherwise it's just grey. The idea is that heterosexuality is boring. Heterosexuality is transphobic. It's offensive. Genital preferences are transphobic. And it's a bizarre agenda. It's absolutely bizarre.
It's got to be so confusing to be a kid right now, especially if you're a quirky, gender nonconforming kind of different kid. I mean, the messages we're giving them, I just think are so unhealthy. And it's so confusing to me how we got to this point.
One of the things I get quite often is that as I said before, very much a supporter of gender critical ideology. And a number of people say to me, well, you can't be gender critical, you're trans. And they see gender critical as the opposite of trans.
Huh.
And in fact, in some ways, gender critical is the opposite of transgenderism. Sorry, gender critical is opposite of transgenderism. Because transgenderism really does push to these sort of gender stereotypes. For me, my transsexualism, because I view it as a psychological disorder, and I do have some resentment for the fact that I transitioned because I needed to, not because I wanted to, and because it did come down to those forced gender roles and stereotypes that actually I resent it. I wish I didn't need to go down that road. I don't want other people to go down that road. And I believe if we are to get rid of oppressive gender roles and stereotypes, we can actually stop people becoming trans in the future. Transitioning is not the easy path that people make it out to be. Not at all. One of the things I did quite controversial was I actually posted on my blog a picture of my surgery to say to people, look, I'm not saying that for some people it's not necessary, but it's certainly not a first choice by a long shot. It is a desperate, desperate measure and a last-ditch effort to try and get back a quality of life.
And I think something that you said that's so important, and that's something I actually, when I first started speaking out about this, I kind of wanted to defend my gender dysphoria as a mental health issue. And I kind of resented that people were saying it wasn't a mental health issue because it felt like they were denying this reality of mine that I knew I had this mental health issue. And they were saying, no, it's not.
If you think of it as a medical condition and you substitute for any other condition, it becomes obvious how grossly offensive it is. If I had a deformity in my leg and somebody else chose to walk with a limp because they thought it was funny, that's grossly offensive. Why is it okay to appropriate gender dysphoria, transsexualism, gender identity disorder as just a way of life? a free choice that, yeah, I'll give it a go. I'll just be transgender. I'll be gender fluid. Today I'll be male, tomorrow I'll be female. Why not? That is so diminishing of the pain and the discomfort that can be so intense with gender dysphoria. And it can take you to such a dark, dark place. And people just don't understand that.
Well, and it also denies children who actually have gender dysphoria appropriate mental health services if they're told it's not a mental health issue.
I spoke about that in a blog post of mine, that we're so busy trying to be open and accommodating and welcoming everybody through the door, that the people that actually do have a clinical need to have psychological intervention, to have psychiatric intervention, are getting denied it. And they're getting told, well, actually, if this is the way you feel, you're going to need hormones, you're going to need puberty blockers, you're going to need surgery. And I've often compared it to that if I went to the doctor with an ingrown toenail and the doctor said, right, I'm going to chop your leg off, that would be ridiculous. And if I found out after having had my leg chopped off that actually it was a very, very easy procedure that would have taken 10 minutes, and that was the fix for it, I would be very annoyed. And I see this very much the same with children. Let's not deny there's children out there that do have severe issues with gender, with the gender roles, and with the stereotypes that are being imposed on them. But we shouldn't be offering a medical transition and permanent solutions to any child until they've addressed the less invasive solutions first, that don't require life-altering medication and surgeries that are very, very difficult, and that I find difficult even as an adult to deal with. That is not the way you approach it. And maybe, quite possibly, there will be some children, a tiny number, that years and years down the line will end up having surgery for dysmorphia. I think there will be significant numbers that can be helped, and they should be helped. And I think a lot within are now coming out and saying, oh, well, if you do that, it's called conversion therapy. I call it curing somebody. If somebody can be helped by the least invasive solution to get better and doesn't require that medicalization, that's a cure, not conversion. And I have absolutely no problem with that. I do not see that as being the same as conversion therapy for somebody who is gay. Being gay doesn't result in potentially life-threatening medications that can lead to all sorts of complications, to heart disease. They can cause brain tumors. They can cause all sorts. And that, we're not being realistic about what the downsides are to this medication.
And not to mention surgery. And that was actually why I initially was interested in talking to you, is you had recently had surgery. And one of the things that I'm interested in is the cost of surgery, the complications, and sort of the physical toll of it.
Surgery was interesting. I don't know if you're aware, there's actually 5 different types of surgery being offered at the minute. One of them doesn't actually create a vagina, which is the one that I had. The other 4 create a vagina. One, the most common one in the UK, is penile inversion. And the skin of the penis and scrotum are inverted to create a vagina. Now, that's a very, very risky procedure. It's trying to create a space between the bladder and the bowel that can lead to perforations, incontinence, can lead to a lot of sort of complications with infections. Second option, which gives me goosebumps even thinking about it, is called buccal vaginoplasty, where they use the lining of the cheek. And they will literally, an oral surgeon will remove the lining of the cheek, which grows back, and they will kind of roll that up into sort of a tube. Third one is colovaginoplasty, where they use a section of colon. Option 4 is abdominal mucosa, where they use keyhole surgery into the abdomen, and they get a section of the lining of the abdomen and they pull it through. Um, that's quite a new surgery and is one that will replace, I think, the penile inversion.
And these are all really invasive and potentially life-threatening and dangerous surgeries. So like what you said, that we have a choice between maybe getting therapy and helping a child resolve their gender dysphoria or body dysmorphia versus what you're talking about, which are incredibly invasive procedures.
Oh, my surgery was a 6-hour procedure.
Oof.
6-hour surgeries are not minor surgeries. Um, I had an absolutely fantastic surgeon, a really, really good person. Um, and he still supports me to this day. I spoke to him last week. I'll probably see him again in another couple of weeks. He was brilliant. And I had very, very few complications. But few complications doesn't mean none. I did have 3 infections. I had an issue with neoclitoral necrosis, where they create the clitoris, but there was a top layer of skin had kind of started to die off. And I would go once a week to my local GP surgery, and they would literally sand it down to try and take the dead skin off. And I would come home once a week on a Monday, and I would get into bed and I would cry. I would take painkillers and tranquilizers. I would cry. It was, and that was a mild complication. Um, Compared to some of the people I spoke to about their surgeries, some people have absolutely horrendous. One person I know that great guy, Scott Nugent. And some of the things that Scott went through are absolutely horrific, and Scott still struggles to this day, having had multiple pulmonary embolisms. I believe Scott's got nerve damage to the arm and struggles with that. And these absolutely life-changing consequences from surgeries. I was lucky, and I have no regrets whatsoever about the surgery. But it was never my first choice. And I did do hundreds of sessions of therapy. And to me, I found that, sadly, as is the case, sometimes when a message gets sent through to a child from a young age and gets sustained all through childhood, sometimes it's just not fixable.
Well, and that's really poignant that you say that, because in your case, it was the way you were interpreting the messages you were getting. But now we have kids who are directly being told that they're born in the wrong body. And for those kids, it seems like we're just complicating the issue. So something that might naturally resolve now, we're actually encouraging this mental illness almost.
One of the things that people will say to me all the time that really makes me cringe, oh, so you were born in the wrong body. No, I wasn't. I do not believe at all in the male brain or the female brain. I don't. I believe that the way our brain develops is a product of our environment, of our education, of the way that we're raised. And I think some people have said, yes, but look at the fact that when you were a child, you would prefer to play with dolls, to go and play rough and tumble with the boys. Yeah, some boys do. It doesn't make you born in the wrong body. That in itself, really just says that the narrow definition of what it means to be male is far too narrow. And we shouldn't be turning around saying you were born in the wrong body. We need to be saying, well, actually, given that some boys prefer to play with dolls, maybe we need to widen the bandwidth of what it means to be a boy. Some girls like to play football and don't like to play with dolls. It doesn't mean they're in the wrong body. It means your definition of female is too narrow. But the whole wrong body thing, I don't get. And some people, they're so friendly and helpful and supportive towards me. And they're being so sympathetic. Oh, it's so sad you were born in the wrong body. And I'm just cringing. I appreciate your support, but no, I wasn't. No. It's a psychological disorder. I'm a man with transsexualism. I'm yeah, I really wish I wasn't a man. But sorry, no wrong body.
So
This is the body I was born.
despite the fact that you have this mental disorder, I feel like you're much more grounded in reality than people who are positing this the new trans ideology.
It'll be so much easier for me that I could tell myself, um, that I'm female. I could tell myself I'm a woman. Um, that I could go on to get vocal cord surgery. I could get facial feminization surgery. I could stealth, and stealthing is okay because apparently if you stealth, as long as nobody knows, that's okay. It's not the truth. Um, and I think for all of us, truth is important to us. And it has not been easy to accept the truth. And as I said before, I wish I wasn't male. But, how many women wish they were, a stone lighter, 3 inches taller, blonde hair, whatever. We all wish for things, but it's not reality. And wishing for things is really just a path to heartache, pain, discomfort, and it doesn't change anything. Accepting who you are, even if you don't like it, ultimately is very beneficial.
And I was just curious because you view yourself as transsexual, which bathroom do you use when you go to public restrooms?
I would still use the male bathroom.
And so, what I think in a way is that what you're doing is really important because you're pushing the boundaries of what it means to be a male rather than trying to push yourself into women's spaces. And so, when you go into a men's bathroom, that right there to me is a much braver act, a much more important kind of act of rebellion of saying I'm not accepting these rigid gender stereotypes.
It kind of goes two ways, because if you asked me, and if I was honest, if you asked me the question, which bathroom would you prefer to use,
Mm-hmm.
it would be female spaces, if I'm honest. However, my discomfort of going into a male space and the sexualization that I face and the comments and objectification is not a reason for me to become a threat to women by walking into women's spaces. And I cannot see how anybody can say, I identify as a woman, yet not understand the fact that women feel threatened by people going into women's spaces because of how easy it is to identify as trans. Now, the common thing that people will come back at me over, oh, you're saying all trans people are rapists or whatever. I am not saying that at all. What I'm saying is that when you can self-identify so easily as something, then anybody that wants access to a woman's space only needs to say the phrase, I identify as, and it becomes a free-for-all. I know I'm not a risk to women. I know I don't have a penis. I know I'm post-op. You don't. And what does a threatening trans person look like? And I've had people say, oh, well, you see, you're not passing, that's a problem. If you were passing, that would be okay. Passing, it's not a beauty contest. Access to women's space is not a prize in that beauty contest. And there have been plenty of apparently passing trans people that have committed the most horrendous of crimes against women. So I don't see sort of passing as being sort of a ticket to using female spaces.
Well, it's also kind of insulting to women, I think, because it means that um, that being pretty sort of defines being a woman. And so if you're a really masculine looking woman, does that mean you're not really a woman based on the idea that maybe you're not pretty enough to be considered a woman?
Sadly, there's plenty of people on Twitter, I'm sure you've seen them, would actually say, yes, it does mean that.
Wow.
Yeah, there's some very funny ideas. There seems to be a sort of subtype of trans at the minute and almost a sort of an exclusive clique that says you have to be passing to be proper trans. And I don't agree with that whatsoever. People will say to me, "Oh, you don't pass. You're not passing." Yeah, I'm not. Um, I could go to facial feminization surgery. I could have all sorts of things. I could do certain things differently. But it's not about passing. No, it's not about trying to convince people. Tell me I'm a woman. It's about relief of my gender dysphoria. And it's about feeling the freedom to be gender non-conforming and live my life in a way that I'm able to do. And if I feel more comfortable wearing clothes that society says are for women, or for wearing makeup, or for whatever, I can do that. I can do that within the boundaries of still saying, you know what, I'm still biologically, I'm still a man. I generally don't even like the word trans woman. I think I will concede to it at times. Because when you use the word trans woman, you then, the opposite of trans woman is a cis woman. And then women become a subcategory of their own sex. And I don't like that. It actually saddens me when I see a woman will say, "Oh, I'm a cis woman." No, I'm sorry, you're not. You're a woman.
Well, it
Full
also
stop.
it
The end.
suggests that there is, and maybe it's because I had gender dysphoria and body dysmorphia as a kid, but I certainly do not have any idea what it means to identify as a woman. I just know I am a woman, and so if somebody were to say I was cis, I don't even understand what that means, and I suspect most women, most people, it's not that they identify as male or female; they are male or female, and so to have the separate category of those who identify as truth and those who don't is really confusing to me.
Yeah, I wrote a blog post that was very, very controversial, and I actually got death threats over it.
Oh wow.
And it was called "Why I Am a Man." Um, and the number of times people come to say, "Well, how can you be trans when you identify as a man?" I don't identify as a man. I am a man. I wasn't identified male as birth. I am male. Let's not dress this up in all these terms. You know, the sex is the one immutable thing in all of this. I can reject gender roles. I can live my life in a certain way. But the one thing that I do not change is the fact that I am a man and I am male. Even if my life is not lived in a way that society says is typical of a male, it doesn't fundamentally change anything. It doesn't change the fact that I don't want to be, but I am what I am.
Well, and I'll
Like,
include I'll include a link to your blog on the description of this video, because I think I read through your blog and I felt like it was so insightful, and you just have an important perspective that I think, and it's so strange to me because you are the real deal transsexual, and yet your voice is being silenced. You're getting death threats. You're being told that the way you're being transsexual isn't okay, and yet to me you're the voice that we should be listening, because you're. It's hard to explain, but it's like, why are we listening to people who are sort of appropriating transgenderism, this huge umbrella, and not listening to you? Why is it that your voice is a threat?
one of the things that I find really, really interesting, there's a huge number of people, I'm sure you see them, that will say to you, some women can have penises, that you can have a penis and still be biologically female. Okay, let's say that's true. The definition of trans is someone who has a mismatch between their biological sex and their gender identity. But you've just told me your biological sex is a woman with a penis, and your gender identity is a woman. So how are you trans? What kind of trans is that? Because there's no mismatch. I can only be trans because my biological sex differs from what society says my gender identity should be. There's no other way to be trans. And if you're claiming women can have penises, etc., that's not trans. I don't know what it is, but it's not trans. And I've yet to get a sort of decent answer from a lot of people on that question.
Yeah, it is. That's something that always struck me, is that if trans women are women, then they're not trans women.
Yeah.
So,
Because if you're a woman and your gender is woman, then there's no trans. So it's a
right.
completely practical argument.
Yeah. So do you have, I'm assuming you live in England based on your accent. Is that correct?
My accent's actually Irish.
Oh,
I'm
Irish. I'm
from
sorry. I'm not very good
Northern
at
Ireland.
accents.
And yeah, I'm living over in mainland UK at the minute.
Okay. And do you have the healthcare resources that you need? Do you have access? I mean, I know here in the U.S. that there's a big dispute about whether or not transgender medicine, transgender treatments are essential medical care or not. And I don't know what Ireland's. Did you get your surgery in the UK?
I had my surgery in mainland UK, yes.
So were you under the NHS, or did you have to pay for it privately?
The NHS, very, very overstretched at the minute, certainly in terms of gender clinics because of this explosion. And what is both bizarre and quite saddening, I went down the route with the NHS and it was dragging on and on and on. In fact, where I am, part of the UK that I am in, you have to be assessed by a psychiatrist first. Then it goes to a panel for them to review. They will then decide whether or not they will fund you to go forward to a gender identity clinic. And then you'll sit on that gender identity clinic for years. When you're actually seen, it could be 6 to 12 months before you get your second appointment. Then it just drags on. So I got through the psychiatrist and I got as far as getting sent through to the gender identity clinic, where it was going to take years. I already knew from my childhood, and it was already sort of documented that I had gender issues. So I took those diagnoses and I went privately and I saw two psychologists. I had the support of my own psychiatrist for my own mental health issues. I was able to then get the hormones prescribed for me through my local health board. I was on the hormones for quite a while. I was then able to have the surgery, and I'm now 10 months post-surgery.
So
And
you
I'm at the end
paid
of
for
my
it
journey.
privately. Do you
I
mind
paid
me
for it
asking
privately.
how much it cost?
In the end, I paid £8,250, which I think is about 11,000 US dollars.
So it's a significant amount of money.
It was a chunk, and I had family help me out, and I borrowed some money to pay that. But what is odd, rather bizarre, I'm still on the waiting list to see the NHS, and I'm yet to have my initial assessment with the NHS. And I've completed my journey. So that just goes to show you how long the waiting list actually is.
Which might be good in some regards, because it might give people who have time to resolve their mental health issues. And I'm just wondering, I'm not a good guess of age either, but just out of curiosity, what was it that made you decide it's time now to go get the surgery?
The mental health issues that I had that were going on for years. I had my third breakdown in 2011, where I had agoraphobia. And I went through 4 different therapists. And one of the things that they kept saying is, look, clearly your anxiety issues and your mental health issues are symptoms of something else. What is it? And I would never tell them.
Mm-hmm.
But I watched years and years go past in my life. I do look back on a lot of lost years where I just stayed at home. I couldn't go out, I couldn't function, I couldn't do anything. And the only thing that was, well, I've made God happy, which I now know not to be the case.
Because you're still a Christian, right?
It's very much a
Very much part of you.
huge part of
Okay.
who I am. Absolutely. I'm not anti-Christian at all, but I think certainly religion has been used to hold a lot of people back. and that's religion, not Christianity. Yeah, it was. I just saw so many years go past, and it was desperation. People have sort of said, "Oh, it was so brave for you to come out. It was so brave for you to transition." It was the complete opposite. It was weakness. It was desperation. It was, look, I just can't live like this. I've had enough. There was nothing brave about it. And I came out and I said, look, this is it. And I remember saying to somebody within the medical profession that I've been working with for the previous 10 years, look, this is what's going on. I need to tell you. And I was expecting to be shocked. And he turned around and he looked at me, well, thank goodness for that. We can now finally start to move forward. He knew for years and years and years. And he sat back and he had to wait for me to come to him and tell him the truth. And was very, very supportive. Yeah, there was a lot of people that knew. But I was trying to sort of, nope, I'm a normal, everyday, standard bloke. This is the part I need to play, and I'll play it rather badly. So yeah, it was desperation that brought me out. I think what is sad is that because I delayed it for so long, that we've got a lot of men of a certain age that are now suddenly transitioning out of nowhere, who are autogynephilic or who have certain sort of fetishes. And I tend to find myself getting lumped in with them. Yeah, well, you transitioned at a certain age, that's what they do. You must be one of them. Which is unfortunate. But then very few of them actually go on to have the surgery.
Right, and that's a really important point. Is that from my understanding, men with autogynephilia, they might get breast augmentation surgery, but they tend to want to keep their penis because they like the sexual arousal.
Somebody said to me not that long ago, a few people said that to me, the fact that you had zero depth surgery means you must be autogynephilic because all you want is something to look at. I thought, actually, no, if somebody was autogynephilic, the last thing they'd want is surgery. If they did have surgery, they would want to have a vagina for sexual activity. The fact that I chose an option that deprives me of any sex in the future, I'm not sure how you can say that is proof that I'm a GP. Yeah, I think too many things come back to sex. You know what? Some of us just aren't that interested in sex. To me, it's intrinsically linked to a lot of people that you see online. Transgenderism and the act of sex seem to just go very, very closely together. And I'm not sure I get that at all.
Well, it sounds like, I mean, I really appreciate your perspective because it is so different. And I'm really thankful that you're talking about this, because one of the debates that I have with a lot of the people who do consider themselves gender critical is that they don't acknowledge that gender dysphoria is an actual mental illness. They think that it's a myth or something. And I've had these discussions a lot. And I think that and I think they're happening because we have the trans community saying that being trans is a normal developmental path. And so it's sort of really confusing people as to, what is gender dysphoria? What is body dysmorphia? What is autogynephilia? What is transgenderism? And it makes it, I think, a little bit harder for someone like you who has those mental health issues to really be understood.
The phrase that I tend to use quite a lot is what's gender dysphoria. And I'm not that comfortable, to be honest, with the name gender dysphoria
I
because
prefer gender identity disorder, I think.
that was I have a diagnosis of gender identity disorder and transsexualism. Gender dysphoria as a diagnosis is quite a sort of loose, watered down diagnosis that covers quite a lot of people.
And again, it's almost imposing those restrictive stereotypes again.
Yeah. I tend to call it, I've got PTSD, and it's PTSD over my male anatomy. And I think people can understand PTSD to some extent more, they can understand the concept of gender dysphoria. But I have a trauma over my male anatomy. People don't understand it. But you don't need to understand it. You just need to know that it is real, and for the people that have experienced it, it is very, very debilitating. And the one thing that always has people sort of wincing, but suicidal ideology. It is used as a weapon to justify letting people transition. That doesn't mean to say that there aren't people who really, really struggle with their gender identity that do attempt suicide and actually commit suicide. That's been weaponized, and it's very, very sad. And I'm not for 1 minute sort of condoning that behaviours. But yeah, people who struggle with gender identity disorder have attempted suicide and have committed suicide. It is very debilitating. And it really was a struggle for me. And sometimes it still is. Transition helped me quite significantly, but it wasn't a magic cure. And I don't think it's a magic cure for anybody. I think you could get into that spiral where you just move from one surgery to the next. And I can go down that route. Well, I feel better because I've had my genital surgery. Yeah, but now my voice isn't right. So if I change my voice, yeah, but now my face isn't right. So maybe I should have facial feminization surgery. Yeah, but now you see, I feel like my chest is a bit too manly looking. So let's have breast augmentation. And actually something else isn't right. You've got to draw the line somewhere. Transition has been a huge help to me, but it was not a magic cure, not at all.
Well, as we finish up here, is there anything else that you want to share? You've shared so much, and I think your insights are so important. And I really appreciate your willingness to really be vulnerable and honest about your experience.
I'm not transphobic, although that's a very sort of thrown out term out there every 5 minutes. I think it is very, very sad that we have a society where people struggle so much with the gender roles that are imposed upon them. I think we do need to change that. We do need to accept that there are people that really, really struggle with their gender identity quite significantly, and they do need psychiatric intervention, psychological intervention. They do need help. Ultimately, yes, there are going to be some people that will go down a surgical route, as it has to be a last-ditch attempt. But I think I have a lot of people you're all just men. We've got men and women. You're just a man. We need to have these discussions. We need to stop looking at transgender as a single entity. We need to start sort of breaking it down and saying, well, actually, we're talking about trans. What are we talking about? Are we talking about transsexuals? Are we talking about transvestitism? Are we talking about people with intersex? And we need to stop being afraid of being called a bigot or a transphobe or whatever, and ask those questions. And I'm on Twitter every day. And I do try to say to people, look, not every trans person is the enemy of gender critical. Not every trans person is the enemy of women. And I'm quite proud to be an ally to women, to people that are struggling. But I'm not going to be shouting from the rooftops, I'm a woman. I'm not. I'm not going to be demanding access to women's spaces. I'm not going to be demanding access to compete as women in sports. Sex is immutable. You cannot change your sex. And any discussions we have, that's where it starts. Everything, and we can move forward from there, but sex is not on the negotiating table. You can't negotiate with biology. It just is.
Well, and once you start changing definitions of these very, sort of basic things, then things just get so confusing. And that's one of my concerns about kids, is that they're now being told that they can be born in the wrong body, or just by thinking something that you can actually be something you're not just because you feel that way. And I just feel like that's sort of just breaking the foundation from under our society when we don't have, these firm definitions that we adhere to. Then really anything goes, and we can start convincing people of anything.
Have you seen the Merriam-Webster dictionary online?
Yeah.
Where the definition of a man is somebody who has the gender identity that is non-female. And if you look up female, it's someone who has the gender identity of non-male. How on earth? I can't figure that out. Never mind kids trying to figure that out.
Yeah, I mean, that's just so
Circular
convoluted.
argument.
And that's so basic that, something as fundamentally biologically grounded as sex is now up for debate, and that anybody can ID as whatever they want to be is just, it's so concerning to me that, if we're doing that with sex, what else are we going to just decide is based on our feelings or our thoughts rather than on some kind of actual reality?
Or, how many times a day do you hear, oh, but science has now moved on. Science now says this. Science says no such thing. Just because you can put a paper together that says one thing doesn't mean it's a widespread, peer-reviewed and accepted study.
Do you know about Peter Boghossian and what he did with his research? He's an American who put together these papers for gender, women's studies and gender studies journals, and he just made up stuff, and a lot of it was just absurd. And he ended up getting it published, and he actually got an award for one of them, and he just totally made it up. I mean, and that's part of the problem is that you can get published in these journals now with nonsense.
One of the things that's very, very interesting that we've come through this, or we're going through this COVID season. And if you look at a lot of the things that we've heard about COVID over the last sort of 6 months, I remember back in March, COVID absolutely cannot be spread from person to person. It is not a threat. Oh, actually, it can. Science changes its mind every 2 minutes. It comes up with all sorts of theories.
I don't know if you're old enough to remember when margarine was a health food and you weren't supposed to eat butter. I grew up thinking, margarine was healthy, and now they're saying, no, no, margarine's not healthy at all. So science is something that, we need to be careful of because it can have an agenda, and we need to look at who's funding the studies and who's funding the journals. And is it really solid, well-grounded scientific research, or is it this kind of pseudoscience that's now taking hold?
There's an awful lot of pseudoscience. I think the problem is when what's being presented is, oh, well, some women have penises. It is so absolutely ridiculous. What kind of science is there to disprove it? It's just bizarre. If somebody said to me, prove that you're male, I'd actually struggle to answer that because it's so glaringly obvious to
It's in
everybody.
every cell of your body. Every cell has male DNA.
Yeah. But that's quite a sort of standard reply I get on Twitter. I'll say something. Well, show me the research. Prove it. Well, actually, you're not showing me the research to say that that's not the case. We have known for millennia the definition of man and woman. Why suddenly now have we suddenly decided actually we got it wrong? We didn't. It's just bizarre, and I think it's very, very sad. The intersex people are becoming the justification for the modern trans ideology. And I've spoken to some wonderful intersex people on the medical complications that they go through their life with because of some of these conditions, and it's become a justification for for trans. But intersex people are not both.
And to me,
they are men with a deformity. They're women with a certain deformity or a disorder. They're not both sexes.
And for them to be sort of used as a justification for there being, some kind of a spectrum of sex rather than male and female, it's the same as dismissing those of us who had or have gender dysphoria as saying there's not a mental health issue there. It's really minimizing an intersex person's experience.
One of the things that, I don't know if you've seen it, but there was a little meme going around, and it said, "I don't have gender dysphoria, I have gender euphoria," and they wanted it renamed. Thought, if you can say that, you don't know what gender dysphoria is.
Right. Yeah, because it's not something that you celebrate, and it's not something that, I mean, your case, I think, is a good example that kind of, it can be debilitating to the point where, you really have a hard time even functioning in society. It's not something, you're not out there with unicorns and balloons and your trans flag, going down parades. That's not your experience at all.
Yeah, I'm pleased to say I've never been to a pride event. I have never waved a trans flag, and I never will. And it's not to say that I don't support people who are LGB. It's not to say that I don't support people who are transsexual and people who are struggling. But to me, modern trans seems more of a political ideology and a movement than it is about what should be people that are genuinely struggling with a debilitating psychological disorder. And that's what it's about. Even Pride was originally about people who were gay, who were facing persecution within their communities. Which is very sad in the fact that there are certain countries, I believe Iran's one of them, where to be homosexual will get you killed. But now what I'm seeing is people at pride events, and it's about celebrating the fact you like to wear a dog collar and have somebody lead you around on a leash. that is making a mockery out of so much.
Well, and I feel like it's really going to push, it's going to have a backlash at some point, I think, because, people don't want to have, men running around in G-strings with collars on, with their kids around. I mean, it's there's some things are really difficult for children to see, and parents are protective of it. And it's almost like the LGBTQ is now just pushing boundaries to the nth degree. And I really worry about the effect it has on kids, because it's confusing to see, a guy in a G-string walking around with a collar and pretending he's a dog. I mean, that's it's a sexualized thing, but it's also just this, it's not about acceptance. It's almost like now it's about um, pushing an ideology onto people who used to support it and be allies, but now it's almost become abusive.
Well, of course, we've got transgender, but we've also now got transabled,
Mm-hmm.
trans age. We've got people that identify as disabled. We've got people that identify as 9-year-old girls.
Right, and that's super concerning. And yet, how different is it? Um, if you can lie about sex, why can't you lie about age?
If you can claim to have changed sex, why can't you claim to have changed age? It's ultimately where it's leading to. The only basis for me has to be a grounding in biological reality. And that's where I try and stay grounded.
I really appreciate you sharing so much. This has been a really helpful conversation for me, and I think it will be to others. Is there any last thing you want to say before we go?
I think I've probably said enough. I could talk for hours.
Well, and I wouldn't mind interviewing you again, because I do feel like your perspective is so important. And maybe, I don't know if you'd be willing to touch bases again in a year and just see where things are. I'm
Yep.
curious, where things are going to be in a year. Things have been so unpredictable at this point that it's hard to know what the situation will be. But I would be curious to see how you're doing and what's happening in the movement.
Yep, absolutely.
Okay. Well, thank you so
Okay.
much.
No problem at all.
Take care.
Thanks. Bye-bye.
Bye-bye.
Bye.